Yeah, so a lot of the times you get the CIPN from there's different types of medications. It could be the vincoacaloids, it could be the platinum-based drugs, it could be the taxane-based drugs. So for breast cancer specifically, many of the patients will take medications such as Taxotere and Taxol. And so what happens is when they undergo this medication, some of the side effects, or they undergo this chemo, some of the side effects is that they eventually get some sensory changes. So when they do have those sensory changes, like you said, it can happen suddenly, or it can happen over a course of time, and it actually builds up. And it'll distribute in a stocking glove type of pattern. So they'll kind of feel it throughout their fingertips, and then it'll run down, and then also in their toes, and it'll go kind of up into their calves. So one of the things that people start noticing when they have CIPN symptoms is that they start walking a little funny. It's not that they're falling yet, but they're starting to kind of stumble, or their significant other notices that they're not walking the same, or they're kind of stumbling into walls or bumping into people that they normally wouldn't do, or they get up to stand and they try to turn, and then they realize, oh, I didn't catch my footing just right. Especially going into the shower, the different types of surfaces into a wet shower or bathtub is a little bit hard and challenging. So if they start to notice the symptoms, I definitely recommend that they get a referral or get an evaluation, to see a physical therapist, because then you can evaluate a little bit more to see how severe it is. Now, when they come in to see me, I go over and actually do some balance tests and measures, see how well they're walking. I also do a cardiovascular endurance test, because of all these chemo medication drugs we know it doesn't only affect their sensory, it can also affect their heart and, their ability for their heart to be able to have that aerobic capacity. So it's going to really depend on that evaluation assessment. They typically don't want the symptoms to become so bad, because if it becomes severe enough, it can affect the muscles, kind of how you mentioned earlier, and it can have some motor changes, which can impact kind of your overall strength in your legs and in your arms. And if you have any problems with your legs, it can create balance difficulties, gait changes, so walking changes, and then also increased falls. And so that's kind of a big one. So when I have patients come in for therapy, specifically for chemo-induced peripheral neuropathy, we work on those deficits. We work on all the balance difficulties, find new strategies in the meantime. A lot of the times that the CIPN occurs, you have that decreased oxygen and blood flow that damages the nerve and supply to that area. And so doing some soft tissue mobilization to the calves or the arms to help improve blood flow can improve vascularization, give oxygen to that nerve, and actually decrease that sensitivity over time. Another thing we do is some taping. And so I have some pictures, if that's okay, if I can show.